Good evening, I'm Sebastien Saint-François. Well, first story tonight, Seneca College announcing it is temporarily shutting down its Markham campus due to the drop in international students. The announcement comes after a string of decisions this year by Ottawa to limit the number of study permits. Dale Manuktuk has the story.
On a Sunday afternoon, an empty parking lot at Seneca's Markham campus isn't much of a surprise. But starting next year, it could be this barren every day, with the college announcing it's temporarily shutting down the facility.
Basically because we are losing international students. Last January, the federal government announced a cap on the number of international students.
The government said it was reducing approved undergraduate study permits by 35% this year. Then last month, it said it would slash international student permits by another 10% in 2025 and 2026. And just this week, the Trudeau government announced it's cutting the projected number of new permanent residents by 20% over the next 3 years.
It is really suppressing the overall number of students, global talent that we can in fact attract to Canada for learning.
The federal government argues the cuts on immigration are meant to correct the balance after admitting a record number of temporary workers.
The federal government has to, stop this kind of announcement after announcement after announcement. We have to create certainty in our market. We did go overboard as a country. I mean, the federal government was approving so many study permits and so many temporary foreign worker permits that we did create some problems.
Seneca College's president calls Ottawa's changes an overcorrection to its immigration policies.
We think we've hit that sweet spot. People are entitled to their opinion, and overcorrection does have consequences if you get it wrong. So we do want to make sure that we are always having a measured response. I believe this is the right one.
Ultimately, the decision to shut down its campus came down to two things.
Operational efficiencies. It didn't make much sense to continue to run a campus that was losing enrollment. And probably even most importantly, we could improve the student experience.
The temporary closure will begin at the end of the fall 2024 term. Programs that were scheduled to be here will be moved to the Newnham campus along Finch Avenue East. That's about 9 kilometers south of here, or 17 kilometers west at the York University facilities. That will take effect for the winter 2025 term. Dale Manuktuk, CBC News, Markham.
Doug Ford says his government will introduce legislation to maintain a temporary tax cut on gasoline and diesel fuel.
Today, I'm thrilled to announce that as part of our fall economic statement, we'll be extending this tax cut through to June 30th, 2025.
Ford says the cut amounts to 5.7 cents per liter for gasoline and 5.3 cents for diesel, which he says will save the average family hundreds of dollars per year. The federal carbon tax on gasoline is currently 17.6 cents per liter and is set to rise above 20 cents per liter next year. Most Canadians get a rebate from the federal government to help offset the cost. Tomorrow is the day Liberal caucus critics said they wanted a commitment from Justin Trudeau to step down. Now, with Trudeau adamant he's staying, it could be the day those MPs say how they'll respond. JP Tasker reports.
Parliament Hill on the eve of a deadline set by 24 disaffected Liberals who want Prime Minister Justin Trudeau to resign or face unspecified consequences.
We're proud Liberals, but we're also saying, hey, reflect, step back, think about it. You need to step down.
Backbench MP Wayne Long is leading the charge against Trudeau. He says the PM has to go now to save the party from a potentially ugly election result.
If we don't step in and make a solid change here, we can allow somebody like Pierre Poilievre to govern for the next 1, 2, 3 terms. That would be disastrous for our country.
The Liberal Party is strong and united.
Within hours of hearing from anxious Liberal MPs last week, Trudeau was adamant he isn't going anywhere, a point he repeated this weekend.
I am determined to lead this party into the next election. I am actually really excited about this fight.
Trudeau says he defied the polls in 2015 and won that election, and he can do it again.
To prejudge the outcome of an election already is something that I don't think people would be too wise in doing.
But Trudeau's poll numbers are much lower now than they were 9 years ago. CBC's poll tracker has the Liberals down some 19 percentage points compared to the Conservatives.
You've got a government's approval rating at the lowest it's ever been, and the Prime Minister himself, his negatives have never been as high.
This pollster says it's Trudeau who's dragging down Liberal Party fortunes.
You know, about 60% of Canadians have a negative view and only 23% have a positive view.
Still, Trudeau's allies are asking wayward MPs to fall in line and focus on their main opponent.
At some point, to keep knifing like this, like put up or shut up.
I do think it's a wild distraction to be talking about this as opposed to the toxic narrative coming out of Pierre Poilievre's mouth. At the end of the day, we need to rally together and focus on the real threat.
Disgruntled MPs haven't decided on a plan for Trudeau if he stays past Monday's deadline. Some say they want to hear from the Prime Minister before taking their next step. At least one has floated voting non-confidence in the government, and Wayne Long, he wants a secret ballot in caucus. Now, there is a chance this fizzles out, but these MPs have still delivered a blow to Trudeau's brand. Pierre Poilievre has pounced, saying, how could Trudeau ask voters for a fourth term when so many of his own MPs want him out? JP Tasker, CBC News, Ottawa.
The City of Toronto is sharing its plans to expand library service in the city. Currently, some locations are closed on Sundays and even Mondays, but as Tyreek Reid explains, soon all locations could be opening their doors 7 days a week.
100 libraries across the city are finally open 7 days a week, including Sundays.
Toronto Mayor Olivia Chow is receiving a round of applause for her latest announcement. She says all Toronto public libraries could soon open its doors 7 days a week by July 2026.
It shouldn't be closed today, right? It's a Sunday. A lot of families are looking for things to do with their kids. In my last budget, we started this work, and in the 2025 budget, we will finish it.
Some library locations currently have their doors closed on Sundays and Mondays. The proposed expansion will cost the city $2 million in its upcoming budget. The city previously invested $10 million to expand hours at some locations. That saw Sunday service begin at more than 60 branches this year. Chow says that phase has already been a success.
It's resulted in a 61% increase in library visits in those branches. So obviously you know that is needed with that kind of number.
The proposal means recruitment efforts will need to increase. The city says 125 full-time library staff will need to be hired to get the plan up and running.
We have another team working on communications and orientation to ramp up any external new staff who aren't familiar with the library service to get them ready for delivering library service.
Until then, library visitors are welcoming the announcement.
It's something that'll be very helpful to a lot of people. I mean, I like to come to the library on Sundays, but we have to come all the way here.
I love the library. I think it's fantastic. I think it should be open as much as possible. So if they want to open for longer hours, I'm all for it.
The city says the move will impact more than just library hours.
The increased open hours means increased programming. Children's programming, adult teens programming, after-school support, seniors programming, all of that will be more available.
If approved, additional library locations could begin 7-day service beginning next year. Tyreek Reid, CBC News, Toronto.
And Sophia Cambalia joins us now with a first look at your weather forecast. It was a lovely fall day around the region today, Sophia.
Sebastian, yes, thank you. There was some lovely sunshine out around the region today. Also some really gusty winds, making it feel into the single digits, and truly with a fall-like vibe. Gusts for anywhere from 20 to 40 kilometers an hour. Will be a chilly overnight before a wind direction really takes us into the warm sector this upcoming work week. Overnight conditions, lows -11 in Timmins. Frosty conditions across much of the northern parts of the GTA and into cottage country, especially some of those higher elevation areas. And -5 with frost conditions in parts of the nation's capital region into the overnight as well. That's where we could also have some light flurries, even some mixing as this narrow band of moisture interacts with that cooler air into your overnight period. It's all said and done by Monday, though, and Monday afternoon we are clawing our way back out and even a little bit above seasonal for those of you in parts of southwestern Ontario. Monday is generally a pleasant day with plenty of sunshine as this ridge of high pressure really begins to assert itself for the first first half of this work week, a southerly flow that will see the 20-degree warmth inch into parts of southwestern Ontario on Tuesday. That's about 10 degrees above seasonal, and right across the board for the 20s for Wednesday. First, a few showers for Tuesday afternoon, bringing in that warmth and that southerly flow, but don't let the 20-degree heat fool you. There is a cold front waiting in the wings that could really put a damper on Halloween plans for many of the trick-or-treaters. I'll tell you about the risk for rain for trick-or-treating in the long range.
Thank you, Sophia. An election was called today in Nova Scotia. Voters will go to the polls November 26th. Progressive Conservative Premier Tim Houston made the visit to the Lieutenant Governor's residence, then straight to the campaign bus. The vote will come far ahead of the province's fixed election date, but Houston says he wants a new mandate before moving on his economic agenda. Speaking of elections, British Columbia is hoping that last weekend's provincial election will have a result this Monday. The initial count left the New Democrats elected or leading in 46 seats, one more than the Conservatives. Several ridings were too close to call, and mail-in ballots didn't change that result, but absentee ballots still could. Recounts are underway in some ridings. With fall in full swing and temperatures dropping, health experts are reminding people to stay safe from seasonal viruses. Starting tomorrow, anyone 6 months and older can get both the flu vaccine and the updated COVID vaccine free of charge in Ontario. The COVID vaccine was designed for the KP2 subvariant of Omicron and was approved by Health Canada in September. The vaccine will be available to anyone regardless of citizenship or immigration status. Even if you do not have an Ontario health card, you will get it for free. And you can find a list of pharmacies and locations that will be offering the vaccine by visiting the province's website. For more on this, I'm joined by Dr. Fahad Razak. He is an internal medicine physician at St. Michael's Hospital and former scientific director of Ontario's COVID-19 Science Advisory Table. Dr. Razak, thanks for joining us tonight. Multiple topics on the table right now: influenza, COVID, and RSV. Let's start with influenza. As COVID seems largely behind us, some people might be thinking, hey, the flu's not that bad compared to COVID. Why should I get vaccinated against the flu? And so what's your answer to that?
Yeah, good to be with you. I think the key thing for people to realize, or the way to approach these vaccines, is really about prevention where possible, preventing severe infection, preventing the disruption it can be for your life if you get sick. And for influenza, we know every year that it can infect thousands of Canadians, and many will get very sick and end up in hospital. The vaccine can reduce the severity of infection, and it's done that consistently over the last many years. And as a frontline physician, I can say that unfortunately, most people that I see end up in hospital are those who are under-vaccinated, and especially if you are higher risk, if you are an older individual or young children, unfortunately, those who have underlying health conditions or are immunocompromised, the chance that you can get a severe case of flu goes up.
Mm-hmm. Can you talk to us about this new COVID-19 vaccine that will be available to the general public starting tomorrow? How close to what's going on right now is it really?
It looks to be very close. And look, this is a challenge. This is a virus that mutates very, very quickly. And we've seen the need for continued update vaccines, sometimes multiple times per year, and then a re-exposure to the vaccine to trigger your immune system. Unfortunately, the version of the virus today is considerably different than even a year ago. And that means that even the vaccines that many people got a year ago, unfortunately, don't give protection against what's circulating now. Now, the good news is that based on preliminary evidence, what we have this year, the KP2 vaccine and the version of the virus that's circulating look to be pretty closely matched. So our hope is that you're going to get, especially again for those who are most susceptible, a significant amount of protection against severe disease. And that is the goal here for the vaccine. We know now that after many rounds of vaccinations, the general public has some level of immunity, but the goal is to keep those who are the sickest or the most vulnerable protected. And then for everyone else, it can reduce the chance that you have a disruptive infection.
And regarding COVID, maybe for people who might not be inclined to get the updated vaccine, can you help us understand the risks, even the long-term risks of catching COVID? How serious can long-term effects be?
Look, one of the lessons I think I've learned as a physician is that infections inherently are unpredictable. So we don't know why one individual may have a significant severe infection right away, whereas someone else will not really have a lot of symptoms, but then develop long COVID or the post-COVID condition, and a third person may have neither. Yes, things like age and underlying health are a factor, but the truth is, otherwise healthy people do sometimes get very sick or get long-term symptoms from these infections. And so I think as a general principle, reducing the chance of infection wherever possible, good respiratory infection hygiene, meaning if you can avoid exposing other people, if you're sick, stay at home if you can, don't expose others. Wear a mask when you're in front of high-risk other people if you have to see them. So, if you're going to see an elderly parent or someone and you have symptoms and you can't avoid seeing them wearing a mask. And then in general, during the peak of these seasons, things like masks can be very effective if you're in a crowded indoor setting like a subway train. Beyond that, the risk of severe infection and the risk of long COVID is reduced by being vaccinated and having your vaccine updated. And that's really where the race to produce these most closely matched vaccines, we have that new version now, that's what that race is. It's about getting people the most updated protection possible.
And speaking of masks, exactly, in Toronto, UHN will again require people to mask indoors. We're fast approaching the 5th-year anniversary of the start of the pandemic. What does that tell you about COVID and the resiliency of the virus?
Yeah, look, our institution, Unity Health, is also doing the same, as are many institutions across this country will require it. A hospital is an area where you inherently have more high-risk people around. Our patients often have very advanced illness. They're on medications that may suppress their immune system. The goal here is that we provide, as clinicians and frontline health workers, we provide the safest environment possible. And so I think this is a good policy. I hope it's not controversial. I think one of the things that was most disheartening the last few years was seeing how routine medical responses could become very political. And so the idea that healthcare workers are going to do what they can to protect the highest risk, to me, makes a lot of sense. It does also tell us something about the virus. You're right, it's the 5-year anniversary in December of the emergence of the virus. The reality is this virus has mutated in a consistent and accelerated fashion over the last 5 years. I don't think there is anything to suggest that our experience with it today is something that will not be something we have to face again next year and the year after and the year after. It seems like our experience with viruses now mean that we have 3 major viruses that are going to plague us every winter. That's COVID, RSV, and influenza. And then COVID itself, unfortunately, can have additional waves the spring and the summer.
Food for thought for sure. Dr. Razak, thank you so much for sharing your insight with us. Dr. Fahad Razak is an internal medicine physician at St. Michael's Hospital and former scientific director of Ontario's COVID-19 Science Advisory Table. You are looking live at Niagara Falls tonight, feeling like 7 degrees. Coming up, Sophia will join us with your forecast for the week. Stay with us. Welcome back. Homeless Connect Toronto held their annual one-stop shop event today. The initiative brings together a variety of services from dental and healthcare to haircuts and much more, all in one place for people to access. Take a look.
This year we had 1,200 or more guests attend our event today. We did expect higher numbers this year because we are experiencing a homelessness crisis here in Toronto. We're seeing huge numbers, not just in shelters, but also outside of shelters. We know we've been dealing with encampments in the city or across the city for quite some time, and so we know that a lot of people are in need of support.
Every single year, the need gets larger in the city, and this particular event brings so many service providers under one roof. We know that people who are experiencing deep poverty and chronic homelessness really have to hustle to stitch together a safety net for themselves. That means they're skipping from one end of the city, one different neighborhood to another to get the services that they need, and this event brings it all together. So this is why it's so popular, and because we are seeing more and more people falling into homelessness, of course the demand on service here gets larger every year.
The guests who come through the doors, they're really happy to be able to access things in one place. And so when they come here, they get to do all these things at one place, at one time. And people are really nice here. And so they feel really appreciated and they're seen and feel, dignified when they're here.
And Sophia is back now with a look at your forecast for the week. The question we've all been wondering about is what kind of a trick-or-treating weather can we expect?
Sebastian, yes, I promised you a snapshot of Halloween. There will be some rain, there will be some wet and messy weather, there will be some warm temperatures. The track and the timing of the wet weather is uncertain, but our weather story really begins in the first half of this work week as we begin to bring in a southerly flow. We are seasonal, as we mentioned, for Monday. By Tuesday, though, have a look at some of the warmth, even double digits all the way across the north. 17 in Thunder Bay, and the 20s begin to inch in into parts of southwestern Ontario. That's warmth along with the wet weather. Underneath this warm sector, on and off showers throughout the day for much of the region on Tuesday. And then Wednesday is the day that really takes the cake. Plenty of sunshine, 20s widespread all the way into parts of the Nickel Belt, Huntsville, and into the nation's capital region. These are temperatures anywhere from 5 to even 15 degrees above the seasonal norm. It could be 20 in Timmins on Wednesday as well. Wednesday overnight, these are our low temperatures. Lows that are actually warmer than most of the daytime highs should be in September and October. Normally we should be about 2 degrees for the low. We'll be about 17 to 19 right across the board. Could be some record-breaking late season minimum temperatures as well. We actually could have some record-breakingly warm Halloween temperatures as well, especially into parts of eastern Ontario and into southern Quebec, into the Montreal region. So yes, you won't need the winter jacket for Halloween. I can say that with assurance, but you may need the umbrella. It'll be warm, but it could be wet as this ridge of high pressure comes in. So does this active storm track between the cold and the warm air, and cold fronts love to ride that, and that's exactly what's going to be happening throughout Thursday. The first half of Thursday, you could have some wet weather. Parts of the Nickel Belt, Timmins, maybe down to the Bancroft area, that could affect the kids for their morning Halloween costume parades and school parties, but by Thursday afternoon, it's widespread showers on and off in parts of southern Ontario. There will be dry slots. You will be able to check the hourly forecast and try to plan your trick-or-treat timing accordingly. But a couple days in the 20s in October is not bad. Have a great Halloween. We are back down to seasonal with sunshine into next weekend. Sebastian.
Thank you, Sophia. Well, that's our show for you tonight, and thanks for watching. But before we go, let's look at these pictures. Over 30,000 pumpkins are on display here in Toronto. Hope you like pumpkins just ahead of Halloween. That's what's going on right now at Sherwood Garden. The event is called Pumpkinville Teo. It's back at Sherwood Gardens, featuring a variety of pumpkin sculptures created by local artists, pumpkin patch, midway rides, and much more fun for the entire family. If you haven't had a chance to swing by the pumpkin-themed experience, it's only open for 2 more days, this Wednesday and Thursday, October 30th and 31st. So a reminder, you can go there, have fun with the pumpkins,